I'm Sister Elaine. I'm a Sister of Bon Secours, and I'm a registered nurse and also a family nurse practitioner. I do some things like a doctor, but I'm not actually a doctor. But I have my own caseload of patients that I see, that I follow for prevention, for chronic illnesses, acute illnesses, colds and things. I've always worked in clinics, worked with people where the people were economically poor and didn't have health insurance. And a lot of my patients there are Spanish speaking, which is nice because I also speak Spanish. Every patient knows I'm a sister. What's harder to get them to understand is that I'm not a doctor. Dr. Elaine, they call me. I said, well, now you know I'm not a doctor. I'm a nurse, a registered nurse, and I'm a nurse practitioner. I'm an especialista de enfermera. And they say, I know, but you're my doctor. They're in a cycle of not taking good care of themselves. Many of the patients there are in the end stages of their diseases. They've got the complications of diabetes and high blood pressure and, drinking too much alcohol. I love working with the patients. I feel like I develop a relationship with them. They don't just come in and get checked and get medicine and go home. They come in and I ask them how their family's doing and get to know them a little bit. Even back when I did floor nursing in the hospital, I said my favorite shift was the evening shift because that was when the families were there. And the work I do now as a nurse practitioner in an office where the patients come and see me, often the families come with them. My prayer on my way to the clinic is, let me hear what I need to hear of what the patient needs to tell me. And often I'll pray with patients. I had a patient once that had Bell's palsy that wasn't getting better. And I asked her if I could do a hands-on. I just put my hands on her face and held it. Of course, she cried. I think that's healing, whether her face got better or not. I think the experience of knowing that there's more than just me, that God's in the room with us. Our community was founded by nurses. The first 12 sisters were nurses. I wanted to make sure I was in a community where I could do nursing. And it was the best match forever. I mean, I knew within a few years, just the sisters caring for the poor, the compassion they had for each other, and also for the patients. I just could identify with it. I felt like this is where I belong. This is a fit for me. And now, some 40 years later, it still is a fit. It still works with me.